the JAMA Network.
A hospital stay for most patients can be stressful, especially if it includes a trip to the intensive care unit. These patients can wind up fighting more than what put them there in the first place.
Mrsa and VRE are both antibiotic-resistant bacteria that are generally acquired in settings like the intensive care unit.
On the left is VRE, or vancomycin-resistant enterococcus. Mrsa on the right can infect patients both in the hospital and out in the community as well.
It's very important that we prevent the spread of Mrsa and other antibiotic-resistant bacteria because these are primary causes of morbidity and mortality among the sick patients who visit the ICU.
Doctors Anthony Harris and Daniel Morgan from the University of Maryland Medical Center and co-authors conducted a randomized trial.
The study involved 20 intensive care units in 20 hospitals across the United States. The intervention consisted of healthcare workers wearing gloves and gowns for all patient contact.
Workers in half the ICUs wore gloves and gowns for every patient. The other half followed the Centers for Disease Control and Prevention guidelines, which recommends wearing gloves and gowns for only select patients.
Wearing gloves and gowns for all patient contact led to a significant decrease in Mrsa acquisition, accounting for about a 40% decrease.
The study appears in JAMA, Journal of the American Medical Association.
The intervention did not have an effect on VRE acquisition.
Researchers also found that wearing gloves and gowns for every patient resulted in healthcare workers washing their hands more often after leaving the patient's room and seeing patients less often.
For the very sick patients who have to go to an intensive care unit, we have a mechanism that may prevent them from acquiring MRSA, allowing them to leave the hospital sooner and healthier.
Catherine Dolph, the JAMA Report.